The Victorian era, for instance, witnessed a surge in charitable initiatives aimed at addressing poverty, illness and social ills. These early efforts, while often fragmented and lacking a cohesive framework, laid the groundwork for the development of a more organized and professional approach to social welfare. Early social worker. One notable example from this era is the work of Octavia Hill, a housing reformer who believed in providing affordable housing alongside social support. Hill's approach, which combined practical assistance with personal development, foreshadowed the holistic ethos that would later characterize professional social work. Similarly, the settlement house movement, pioneered by individuals like Samuel Barnett and Henrietta Barnett, sought to bridge the gap between different social classes by establishing community centers in impoverished neighborhoods. These centers offered a range of services, including education, healthcare, and recreational activities, aiming to empower individuals and foster social change. Early social worker. These early endeavors, while driven by genuine compassion and a desire to alleviate suffering, often operated within a framework of moral judgment and paternalism. The prevailing belief was that poverty and social problems were often the result of individual failings rather than systemic inequities. This perspective influenced the nature of assistance provided, which often came with conditions and expectations for recipients to conform to certain moral standards. However, as the 19th century gave way to the 20th, a growing awareness of social injustice and the limitations of charity-based approaches began to emerge. The rise of industrial capitalism, with its attendant problems of urban poverty, unemployment and social unrest, exposed the inadequacy of purely charitable responses. There was a growing recognition of the need for a more systematic and professional approach to addressing social problems, one that went beyond simply alleviating immediate suffering and sought to address the root causes of poverty and inequality. Early social worker. This shift in thinking paved the way for the emergence of social work as a distinct and professionalized field in the 20th century. The year 1970 marked a pivotal moment in the history of social work in England. It was the year that witnessed the unification of various social care services and the formal recognition of social work as a single, integrated profession. Early social worker. Prior to this, social care was fragmented, with different professionals catering to specific needs. For example, probation officers working with offenders, child welfare officers dealing with children and families, and mental health workers supporting individuals with mental health issues. This fragmentation often led to a lack of coordination and inconsistent approaches in service delivery. The creation of the Personal Social Services Councils, as recommended by the Seabohm Report in 1968, aimed to address this fragmentation. The report, officially known as the Report of the Committee on Local Authority and Allied Personal Social Services, argued for a more integrated approach to social care, one that brought together different strands of social work under a single umbrella. Early social worker. This vision was realized with the implementation of the Local Authority Social Services Act in 1970, which led to the establishment of local authority social services departments across England. This landmark legislation brought together various existing social care services, including child welfare, mental health and services for the elderly, under the purview of these newly formed departments. This integration was significant in several ways. Firstly, it allowed for a more holistic and coordinated approach to service provision. Instead of individuals and families having to navigate a complex web of different agencies, they now had a single point of access to a broader range of support services. This streamlined approach facilitated more effective communication and collaboration between professionals from different disciplines, leading to more comprehensive and tailored interventions. Early social worker. Secondly, the unification of social work in 1970 professionalized the field further. And with the creation of unified social services departments came the need for a standardized qualification for social workers. The Central Council for Education and Training in Social Work, established in 1971, became responsible for setting the standards of social work education and training in England. This move ensured that all practicing social workers met a certain level of competence and professionalism, enhancing the status and credibility of the profession. The unification of social work in 1970 was a watershed moment. It laid the foundation for a more integrated, professional and holistic approach to social care in England. The impact of this landmark event continues to shape the profession today as social workers strive to meet the complex needs of individuals and communities within a constantly evolving social landscape. The legacy of 1970 is a reminder of the ongoing need for collaboration, innovation, and a commitment to social justice within the field of social work.
Social work today is more crucial than ever. We're seeing an increase in the number of people needing support, especially with the rising cost of living and global issues impacting communities.
Indeed, the focus has shifted significantly. Social workers are not only addressing individual needs, but also advocating for systemic change to tackle these broader challenges.
The COVID-19 pandemic was a defining moment for social work. It underscored the importance of our profession and the need for robust regulations and standards to support social workers in their vital roles.
Yes, the pandemic highlighted both the strengths and the areas needing improvement within the sector. It also accelerated the adoption of new practices and technologies in social work.
The challenges on the front lines are evolving. With the cost of living crisis and global issues such as climate change, social workers must adapt their approaches to meet these new demands.
Absolutely, it's a dynamic field that requires continuous learning and flexibility. The ability to respond to these emerging issues is critical for the future of social work. Upholding standards in social work is crucial. Social Work England plays a pivotal role in maintaining these standards.
Indeed, Social Work England ensures that practitioners are competent, ethical, and continuously improving their skills. This regulatory body is fundamental to the integrity of the profession.
The shift from charity to empowerment marks a significant evolution in social work.
Absolutely. Technology and collaboration have transformed our approach, allowing us to empower individuals and communities more effectively.
Evidence and equality are the cornerstones of modern social work practice.
Yes, using evidence-based practices ensures that our interventions are effective, and promoting equality is at the heart of everything we do, striving for a fairer society.
Technology and collaboration are essential in today's social work landscape.
Working together, we can harness technology to